Which of the following is not considered a vital sign? The answer is body weight. What term refers to a significant increase in body temperature above normal levels? The answer is hyperthermia. Which part of the brain is primarily responsible for regulating body temperature? The answer is hypothalamus. The process by which the body maintains a stable internal temperature is called. The answer is thermoregulation. Which of the following increases heat production in the body? The answer is shivering. A body temperature of 38.5 degrees Celsius, 101.3 degrees Fahrenheit, is classified as. The answer is fever, pyrexia. The normal adult body temperature ranges between. The answer is 36.0 degrees Celsius to 37.5 degrees Celsius. Which of the following factors does not affect respiratory rate? The answer is gender. A normal adult pulse rate ranges from. The answer is 60 to 100 beats per minute. Which of the following is essential for maintaining normal blood pressure? The answer is regular physical activity. Which of the following is the most common site to measure body temperature? The answer is oral cavity. Which of the following factors could cause a patient's pulse rate to increase? The answer is fever. A patient is experiencing difficulty breathing. The nurse observes that the patient is using accessory muscles to breathe and has a rapid respiratory rate. What is the nurse's primary action? The answer is administer supplemental oxygen. When measuring blood pressure, the nurse observes the following readings: 160/98 of a millimeter of mercury. What action should the nurse take? The answer is reassess the blood pressure after 5 minutes. The nurse assesses a patient's pulse as 58 bpm. This finding is consistent with. The answer is bradycardia. Which of the following interventions is appropriate for a patient with a fever of 39.5 degrees Celsius, 103.1 degrees Fahrenheit? The answer is providing cold compresses to the forehead. A nurse is assessing a 75-year-old patient's vital signs. The patient's temperature is 38.4 degrees Celsius, 101.1 degrees Fahrenheit, pulse rate is 92 bpm, and respiratory rate is 18 breaths per minute. Which factor is most likely contributing to the patient's temperature elevation? The answer is a possible infection related to recent surgery. A nurse is assessing a patient's vital signs. The patient's temperature is 40.0 degrees Celsius, 104.0 degrees Fahrenheit, pulse is 130 bpm, and blood pressure is 110/70 of a millimeter of mercury. Which of the following is the nurse's most appropriate action? The answer is apply cooling measures, such as a cooling blanket. A nurse is reviewing the vital signs of a patient admitted with sepsis. The patient's heart rate is 122 bpm, blood pressure is 80/50 of a millimeter of mercury, and temperature is 39.2 degrees Celsius, 102.6 degrees Fahrenheit. Which of the following should the nurse anticipate based on this assessment? The answer is the patient is likely to be in a hypermetabolic state due to infection. A nurse is assessing a patient who has recently undergone a major surgery.